World Immunization Week, celebrated in the last week of April, aims to highlight the collective action needed and to promote the use of vaccines to protect people of all ages against disease. The World Health Organization works with countries across the globe to raise awareness of the value of vaccines and immunization and ensures that governments obtain the necessary guidance and technical support to implement high-quality immunization programs. The ultimate goal of World Immunization Week is for more people and their communities to be protected from vaccine-preventable diseases. And joining me now to shed more light about this week is Health Manager, UNICEF, Dr. Clement Adams. Good to have you join us, Dr. Adams.
Thanks very much, and thanks to all your listeners.
So when it comes to immunization, I think so far, our biggest success is in terms of polio. We have successfully eradicated polio in the country. We have been declared free. But talk to us about where we are in terms of ensuring that people are vaccinated against preventable diseases in the country.
Thanks very much, and thanks to your listeners. At the moment, efforts are being done jointly by WHO, UNICEF, other partners in partnership with the National Primary Healthcare and the state primary healthcare to ensure that we are able to reach all communities and reach all children to immunize them. Over the years, we've been progressing. The progress has been going on very steadily. However, we do acknowledge the fact that we are not to the optimal level that we desire to be, but there's been progress, and the progress has been quite remarkable in the past few years. As you know, we have been able to eradicate wild polio virus, and of course, we have also been able to ensure that a lot of children are immunized against measles and other diseases as well. So there's been progress that we've been making over the years.
And what are the biggest areas of challenges? If you can hear me, Dr. Adams, I'm asking the areas of challenges.
Thanks very much. The biggest areas of challenges has to do with how to be able to reach all communities. We do have some communities that are very hard to reach, and so it is quite difficult, and the terrains are quite challenging on how to reach these communities. This is one of the challenges. In some areas, for example, in the northeast and the northwest, we also do face these challenges of the insurgency that makes that some of the communities are cut off from us, and we are not able to reach them as we should be reaching them monthly. And of course, we also require some level of funding to ensure that optimum uptake of services is improved. So community mobilization activities and community sensitization activities needs to be at the optimum. And these are some of the challenges that we face, that we are not able to reach everybody. And of course, we have cultural norms. We have vaccine hesitancy from people, and we have traditional issues that are also bedeviling us as we try to change people's behavior towards vaccines.
Absolutely. Culture has played a huge role. And I also imagine that with the several misinformation concerning the COVID-19 vaccine, that it will spiral out of control in terms of other vaccines. But let's talk about insurgency, because I imagine that to be a big challenge and the areas that you cannot reach. So what sort of collective effort would you require to ensure that those people in those areas or children in those areas are vaccinated?
Thanks very much. And it's a collaborative effort, and we've been doing that over the years. It's a collaborative effort between all partners, WHO, UNICEF, other NGOs. It also involved the state primary healthcare of those specific states, specifically in Borno, Yobe, Adamawa, Sokoto, Zamfara, and the rest where we have the challenges. But it also involved us also working collaboratively with the civilian JTF and also with the military. That will ensure that we are able to, they are able to help us out to get access into these places. And it also involves us working with the community leaders, the Pulamis and what have you, to ensure that we are together, we all come together to see how best we are able to get these children to immunize. So those are some of the strategies we've been using in trying to reach these children.
And I guess we have to continue to put the word out there how important immunization and vaccination is, especially in preventing diseases. Thank you so much for talking to us. The Health Manager, UNICEF, Dr. Clement Adams.